This is Betty Smith with Sauter County Daily News. We're doing Season 2, Show 4 with the this week's review preview. And I have the pleasure today to be with Dr. Provaznik from King's Daughters Family Medical Center. Is that a good way to put that?
That is.
Okay. And, and I'm very glad to have you on the show today. We have been trying for a month now to try to get someone in and talk about some of the health things. You know, it's the new year. Okay. So I'm going to kind of toss it to you. And if you would like to give me some details, like some things you might refer, like if I was going out to dinner.
Okay. Well, if you're going out to dinner, it depends on where you're going to. Certainly fast food, pizza, or more of a sit-down type dinner.
Okay.
And one of the things that you can look on all the menus, regardless of where, is the calorie counts. And they're all required by law to list the calories of every item on the menu. And so you can kind of judge how much you should be eating. You know, if the average person should use 2,000 calories as an average diet for a day, then you can determine how much you should be eating at that meal and break those 2,000 calories up.
Especially when, you got Valentine's Day coming up and everybody likes to go out and eat or spend it with their special someone. and that's why I think of those things,
And that does make it more difficult because, A, you don't want to save all 2,000 calories up for dinner. You do want to split them up during the day. And then when you do go out for that special dinner, and again, as long as you don't have lots of special dinners, you can fudge a little bit.
So have like a cheat day? Are we allowed cheat days?
Have a cheat day as long as it's not every day.
Okay, that's good to know. Now, some of the, I don't know if you had an opportunity, I left some flyers. Was there any recommendations on some of the restaurants that you thought stood out with, like you were saying, with the menu and...
Again, most of the flyers you have left, I mean, from the area, I've frequented some of those restaurants, mm-hmm. And for the most part, they're not healthy choices. They're tasteful choices, but not healthy. And again, it gets back to the occasional, the moderation, and portion size, is what you have to choose. Most of the restaurants in the area are fried and greasy foods. And so if you're looking for something, simple as a steak, baked potato, that's a reasonable, option for a meal. But the fast food places, for the most part, are not recommended.
Right. See, I'd be like, steak potato. It's good information, so that's what I always like about that. So I know you guys got some upcoming events, and so I would like to ask about that. I know, like I said, January's kind of coming to an end, and we all talked about resolutions and trying to look better or better our finances, and everything's like a work in progress. But February, what is the big thing that you guys do in February?
February's Heart Month, I believe.
Okay.
So again, it's more focused on heart health. And again, it gets back to diet. Heart health is diet oriented, and if we all followed a good diet, and a recommended diet would be either a vegetarian or a Mediterranean diet, and those have been actually shown over time to reverse atherosclerosis and heart disease.
Huh, that's good to know. Yeah, because I know, like with the whole hat day and stuff coming up, and the women also do the whole red hat. So
the red hats, right?
Yeah. So with with it also being the first of the year, and I know a lot of times we just think going to the doctor because we're sick. What is some things that you could advise that people come to you for?
It's better to certainly we're available when you're sick, and that's what we do. But again, our goal is to keep you from getting sick. And again, that's better for your long-term health and mortality. And so coming to the doctor, it depends on age and depends on health issues. But if you're a relatively healthy person, we should see at least once a year. There are maintenance things that we should do, and just check blood pressure and check weight and things along those lines, just to monitor that so problems don't get out of hand. Okay. And again, the older you get, then the more frequent your visits become, or if you have chronic disease issues, such as diabetes, blood pressure problems. Then we check you more regularly to keep those problems in check.
Man, that's a long list for me. Because I kind of tease behind the scenes because I have that big 50 birthday coming up this year, so I kind of worry about some of the things that I should be in line with.
Well, see, the good news is at 50 birthday, all those health screenings and health maintenance issues, they're dropping to even 45 now.
Oh, okay.
So that, colon cancer or colon screenings were always 50, and now recommendations are 45. So you're behind.
Well, unfortunately, I've already had to do that. I've already been on top of that. But so last but least, because again, we're here with Dr. Provaznik from King's Daughters, and we're here at the Doctor's Inn in Willersburg. I guess what I want to follow up with or kind of say is for people to come to you, how do they reach you? Or
I tell people again, we're the only Provaznik in the phone book. So it's easy to find the phone number. Certainly calling King's Daughters, they can connect us to there also.
Oh, okay.
So the direct calls or through King's Daughters.
So are taking open clients at the time or right at the moment?
Oh, I always enjoy new patients. It keeps things fresh for me.
Oh, good. Yeah.
Always good to see fresh problems.
Keep it lively. All right, well, I'm going to shake your hand, and thank you for that. And then I'm going to introduce Mark Craycraft into the room, unless he had anything extra to add.
No, I just thank you very much for your time and for being able to do this.
Oh, glad to get information on health out. That's the whole goal, and the goal of health is to make you feel better and enjoy things more. That's the goal of health.